Hey guys, the Gait Geeks here, Ivo and Scott. We found this video when we were looking around online. We really liked it with Doctors Connolly and Perez from Gait Happens. We want to offer a little commentary on that, so here we go.
Today we are going to be talking about when I would recommend this shoe over this shoe and vice versa. So first of all, here we have Tolos. I love this shoe. I'm currently wearing this shoe. And then here we have the Experience Flow from Ultra. Now, both of these shoes offer a nice wide toe box. Remember when
So toe box shape is super important, and they highlight that here. We like to emphasize too that the toe box shape needs to match the shape of your foot. Some people have an elongated second metatarsal bone, so their foot doesn't come down on a straight angle. It goes up and peaks a little bit and comes back down. We want to make sure that there's plenty of room there. So some of the wide toe boxes are going to be angled, okay, from medial to lateral. Some of them are going to be more of a rounded. So again, it depends upon the shape of the foot. So when you're looking at clients or patients and you're looking at their feet, look at the shape of the shoe versus the shape of the foot.
Yep. And bunions and bunionettes play a role in that too, right? So if you've got extra width on either the medial or lateral side, that's going to obviously really make these type of shoes with wider toe boxes really super beneficial.
we're talking about toe box, we want width here, not necessarily width here. So the difference between a wide shoe and a wide toe box shoe is the shape, not getting the same shoe in a size wide. That's something different.
And then men's and women's shoes are a little bit different too, right? So we need to think about, specifically in the width of the heel. That's a super common spot where they may differ. Women's heels tend to be a little bit narrower versus the men. And if the last for a cheaper brand of shoe, let's say, is very similar, whereas the shape of the shoe for men and women is built off the same kind of shape, oftentimes you might get extra slop built into the heel, causing more excessive wear around the heel. You'll see the inside of the shoe torn up a little bit more as their foot and rear foot starts to slide a little bit more. So that's something to consider between men's and women's shoes.
Yeah, we like to say that guys' feet are shaped like rectangles and women's feet are shaped like inverted triangles. So a lot of times the vamp, the middle part of the shoe, which comes up and under and gives you an arch, particularly if the shoe doesn't have any arch support, is going to be much narrower and it's going to hug that midfoot a whole lot more in a lady's shoe than a guy's shoe. That's not to say that there's not guys out there that have inverted triangle feet and not women out there that have rectangular feet. Again, the foot needs to match the shoe or the shoe needs to match the foot. When we were talking about shoes that are kind of made off the same last, Crocs is a perfect example, right? You can see shoes that are like that are pretty much the same except for the color.
Both of these shoes offer a nice wide toe box, which is going to allow the toes to splay and function better.
Another thing to think about, with a wide toe box, we kind of talked a little bit about it with bunions and bunionettes, but the reason why someone would potentially, require extra room is to put some toe spacers in there. Obviously, when you have a bunion, you often see the hallux abductor valgus, or I call them HAVs, which kind of causes a little bit more of that movement of your first toe towards your second. And toe spacers are great tools to use to help normalize the alignment of your toes with the metatarsals. And in doing so, you're going to need to make sure you have extra width. I know, Iva, you have certain brands that you like. I send most of my patients to Amazon and tell them to find one that fits their price range and fits one that is obviously comfortable for them. But I know you kind of have a couple you prefer.
Yeah, and it's more what you're trying to accomplish as far as that goes. Some of the toe spacers like yoga toes and things like that are going to be very, very large between the toes, so you're going to get a ton of splay. Some people, if they're first starting out with toe spacers, aren't going to be able to utilize something like that because it's a little too aggressive. We really like the Correct Toes product from Ray Clanahan out at Northwest Foot and Ankle. It's a silicone product, so it doesn't stink like rubber does, things like that. It's got a nice slippery feel to it when you're putting it on. They come in different sizes, which not only accommodates the foot, but also accommodates the degree of spread. That's not to say there's not other stuff out there that's just as good, that's probably less expensive. Mm-hmm. But again, depending upon what kind of toe spacers you're using, and take a look at it, take a look at the shoe. You cannot have the shoe laced, place their toe spacers in, and then have them put their foot literally on top of the shoe to see if there's going to be enough width so they can wear it in there. Obviously, toe spacers work on two things. One, it realigns the muscles for better anatomical pull, so we get better mechanical function of the muscle, and two, plastic deformation of the tissues. So just by stretching that ligament for a long period of time, we're going to increase its length on one side and decrease the length on the other side, much like remodeling occurs in bone, except with ligaments.
Another thing to consider also is how well does the toe spacer actually sit on the toes? Like, do they move when they're walking, or are they staying in a nice stable position where the patient client doesn't have to really think about it too much, right? There are some where I've seen patients actually almost like grip their toes to try to maintain that position of the toe spacers within them. And there are some that actually slide over the big toe and actually loop around it and kind of hold it in place a little bit better than others. But that's just something I've seen with some of the cheaper ones that aren't really made to function in. They're more made to kind of just rest and sit in.
So, right. And if we have friction with a moisture source over time, we have blisters and then ultimately calluses. And we talked about that in one of our other presentations.
But there are circumstances where I prefer one over the other. So first of all, this shoe has a much smaller stack height or amount of cushion versus this shoe where you can see there's a lot more cushion, which is going to make this shoe more stiff. With the Tolos,
I think we wanted to talk a little bit here about stack height versus heel drop. So stack height obviously talks about a very consistent thickness, for lack of a better way to describe it, across the entire sole of the foot, sole of the shoe. Whereas heel drop really is the difference between the stack height of the heel versus the stack height of the forefoot. It's that drop, right? So traditional shoes, especially with PEC shoes, which are pronation control elevated cushion heeled shoes, they tend to be more stable, stability built, and tend to have a higher higher heel drop, which anywhere from 12 to 14 millimeters. If you start thinking about some of the minimalistic shoes, more of the natural shoes with zero heel drops, or even minimalistic in the 4 or less heel drop range, what that does to the foot and the biomechanics really changes, right? So in a high heel drop shoe, your foot's a lot more plantar flexed. It's a lot more inverted and actually adducted, which creates more of that supinatory posture, which then again, as I know Ivo likes to talk about with things like internal tibial torsion and forefoot varus or forefoot supinatus, how that kind of plays. And I know, and I'm gonna leave the floor to you because I know you like to talk about this stuff.
No, actually, you nailed it on the head. You know, when you have a foot that's going to be somewhat more inverted, the more drop we put in, the more plantar flexion. Now, all of a sudden, the shape of the talar dome comes into play. Just from a pure physics standpoint, because of the shape of that, the higher we raise that up with respect to the forefoot, which now is the part on the ground which is supporting it, as the forces come through, it creates more of an inversionary force. So shoes also with a higher drop and a thicker midsole or a more of a stack height are also going to have a tendency to be more torsionally rigid. So the more torsionally rigid that is, the more of a motion control kind of shoe that is, or the more it's going to try to limit some of that midfoot pronation. If you have a cavus arched individual with internal tibial torsion and they're a little dink-toed and a little bit of forefoot inversion, and now all of a sudden I stick them in a motion control shoe, I'm not going to allow that foot, which actually needs to move, much like Dr. Perez is talking about a lot of times in her video here. It's going to limit that movement and actually create problems. And since the foot can't compensate now because it's locked into this plantar flexed, inverted adducted position, the compensation is usually going to occur north of there. The knee will often start barking first because it's a hinge joint, between two ball and sockets, the heel and the ankle, or it could be the heel or even as high up as the contralateral shoulder.
And I think another thing to consider with a high stack height, or one that's really more so than just a minimalistic type of shoe, let's say, is you tend to lose some of that kinesthetic awareness, right? Because the cushion is so excessive in a lot of these shoes. The foot really doesn't know where it is, and therefore the rest of the body really doesn't know what it is. And we see this, or I see this a lot with runners that run with a really thick stack height shoe, is that they don't tend to absorb efficiently through the rest of their body, and they tend to rely heavily on the shoe doing all the work. And I think that's that's counterproductive. And I know that Dr. Perez feels the same way with a lot of, her recommendations with going with less is more. And I tend to agree. There are cases where, extra cushion can be helpful. I always say use as much cushion as you need, or as little cushion as you need, right? And just be aware that your body will function slightly different if it's got too much cushion there, because it's not going to really feel so well. It's like landing on a mat, right? Oftentimes I use the comparison. Gymnasts punch the landing on mats because they can't feel the stability that they need unless they get through that cushion thickness fast. And I think running or walking, mainly running in these really high stack heighted shoes, I think can create that same issue.
I can roll over. I mean, this shoe really is truly very flexible. So when I go over my big toe, when I'm walking, moving, it's going to force me to use my muscles, use my ranges of motion, which is healthy, right? We have to use our feet. It's use it or lose it when it comes to anything with the musculoskeletal system. We need to maintain our ranges of motion and we need to maintain our strength. So using a shoe like this is going to make your feet work, which is a good thing. But
Go ahead,
Go ahead,
Ivo.
Scott.
I was going to say, I agree, right? We need to, Dr. Perez makes a great point, right? We really want to make our foot muscles work until we don't want to make them work, or we want to rest them a little bit, right? So there are certain situations where, a shoe that allows the foot to move as free as possible may not be the greatest, especially if there's issues where there's discomfort or pain and we're trying to protect or rest those. When I'm working with a lot of my athletes that are required to perform even when they're not feeling their best, sometimes a shoe with a little bit more support and structure allows that tissue to be offloaded a little bit more. And I find them to be beneficial too. But as you like to say, you've got to earn the right to wear those type of shoes. So why don't you expand on that point?
Yeah, so I agree that the foot definitely needs to exercise more, and Dr. Perez makes an excellent point talking about that. And in just a second here in the video, she talks about transitioning over. But to even be in a shoe like that in the first place, you really need to have the foot competency to be able to actually do that. Remember all of the people that read Born to Run, and then they went out and started running barefoot or in, minimalistic, Vibram 5-finger shoes. And they had stress fractures, and they had all kinds of metatarsalgia and sesamoid issues, and all of these things because they went from 0 to 60 without working the appropriate muscles over a long enough period of time and going through a decent transition period. So definitely we want to emphasize that, yes, you want your foot to work as hard as it possibly can, but we don't want to overwork it. So you may want to think about something like, gee, we're going to wear this minimalistic type shoe for the first hour of the day and then switch to something a little bit more supportive throughout the day as my foot starts to fatigue and my muscles start to lose endurance, or half of the day, or something along those lines. But again, yes, the flexibility is important. Yes, it's important to have that. Yes, we need to maintain our ranges of motion. We just need to make sure that we're offering the person enough support to be able to do that. Think about if you held a weight out in front of you with your arm out straight, how long could you do that? And if you started, maybe you might get a minute, maybe you might get longer. And then over time, if you did that every single day, you'll be able to hold it longer and longer and longer. Well, your foot muscles, because they're going to be active, particularly intrinsics, pretty much from mid stance through terminal stance and pre-swing, they need to be transitioned slowly, or you're going to get trigger points, you're going to get pain in your feet, you're going to get soreness, and then if the muscles start to give out, then it's going to start to yank on the plantar fascia, and that's going to start to create issues down in that area as well.
I think it's the exact reason why, some of the stigma exists around forefoot running and barefoot running is that a lot of people that are anti that will say, well, you really increase the likelihood of forefoot injuries and calf injuries. And that's very true if you transition too fast and you don't have the capacity in that tissue that is now accepting the load. Because when you run on a rear foot contact versus running on a forefoot contact, the actual muscle involvement is quite different, and the loading mechanics are quite different. I always say, like, if you have knee pain, a good strategy may be to shorten your stride, increase your cadence, maybe make more of a midfoot to forefoot kind of contact. And what that does is, Brian Heiderschott and his group really kind of proved this, is that it really decreases the stress to the hip and the knee. But again, I oftentimes say there's no change without consequence. So what happens is the stress now goes more to the forefoot, the metatarsal heads, and even into the calf. So if people make that transition too fast, people would often say that now their likelihood of injury in those other areas has really increased. And that's true because their capacity wasn't able to deal with those demands. So with anything, we just got to make sure that there is a ramp up period, like Ivo and Dr. Perez both talked about. And there's a time and a place for a lot of these changes.
But this is what I recommend for, let's say, 80 to 90% of my patients, with a proper transition period, by the way. But for the 10 to 20% that come in that have more chronic injuries, specifically severe arthritis at the big toe, or fusion post-surgical at the big toe, those patients, no matter how much we work on stretching and mobility, we're not going to get the range of motion out of the big toe that we need in order to push off properly. So what those patients are going to end up doing is either going off their outer toes or spinning around, and those compensations can lead to problems down the road.
So what she's talking about here, and Dr. Perez, outlines excellently, is basically high and low gear push off. So remember that when the foot hits the ground, force should travel up the lateral column of the foot, across the metatarsal heads, and then go out the large toe. That's called high gear push off. When it occurs coming off on metatarsals 2 through 5 because you have a Martin's toe or a forefoot varus, or you just can't get the weight across or something like that, that's called low gear push off. So high gear push off is ensuring that that foot is in the maximal amount of supination so that we can move forward. Well, that's probably not totally true, because if you're in low gear push off, you're actually going to have a little bit more of a supinatory moment. But it's the most efficient because we're getting the weight coming off of the big toe. We're able to engage our sesamoid bones along with the tib posterior, along with the flexor hallucis longus, along with the flexor dig longus, as well as brevis, and all the foot intrinsics, so that everything is working in concert together rather than not in concert. If we're towing off in supination, now we're relying a great deal on other musculature to help to propel us forward, which aren't necessarily designed to fire at that point in the gait cycle.
We also got to make sure, and again, I think another way to describe that is making sure that you're pushing off your big toe with high gear push off with an adequately supported arch, and one in which doesn't create what I would classify as a medial heel whip, right? Where they're actually coming off maybe the big toe, but as a result, they're pivoting off their first and second a little bit more because they don't have adequate dorsiflexion maybe, or because like they have an externally rotated forefoot, abducted forefoot. So all of those kind of mechanisms kind of play into it too. But again, high gear versus low gear is you want to make sure that you're getting off that big toe and stabilizing that first ray and having a nice rigid push off and coming off that big toe. If you don't have adequate range of motion through that big toe, it's going to affect you in so many different ways, whether it be just in your day-to-day or in performance for that matter too.
Yeah, you need...
Sorry.
I was just going to say, you need 50 degrees of dorsiflexion at that first metatarsophalangeal articulation is really what we need to get the job done. More, it's supposed to be able to move up to 65. I don't know too many people like that. But as we start to get less and less, then we develop what's called hallux limitus. You can have a functional hallux limitus where it's limited because of position, or you can have a true hallux limitus where it's limited because of osteoarthritic changes due to enthesis or some sort of arthritic change or a dorsal exostosis, which occurs, which actually limits how much dorsiflexion is available at that first MTP.
Mm-hmm.
Shoe that allows us to spread the toes with that nice wide toe box, but that we can rocker over because it has this taper, is a really great option for those patients. So again, for those that can't extend the big toe, using a shoe where we can roll over the shoe rather than having to bend, because in this case, we don't have that range of motion, is a really great option so that we're not compensating and going around. So that's where I really like the experience line from Ultra. They do a really good job of offering that taper at the front.
So she's talking about forefoot rocker here in the shoe. And she makes a great point about when you have people with functional hallux limitus or hallux limitus, that it really decreases or eliminates the need to have that dorsiflexion. That's why hiking boots are designed with a lot of rocker in them with the stiff sole, so that we can roll over that, because you usually have a pack on your back. It used to be the days where they were heavy packs. Now they're light packs because everybody does the ultralight thing. One thing we would just caution when you're looking at this and you're looking at rockered shoes is watch where the rocker is. In other words, where does that slope come down to and hit the ground? And where is that with respect to where your foot is? Generally, we like a rocker to be right at the first metatarsal phalangeal joint. That's right where the big toe meets the rest of the foot, kind of the knob that's on the inside where we get bunions and things like that. That's sort of the ideal position for that. And then the ramp of the rocker, if it's super steep in the front, or if it's a shallower, which is going to control how fast it is that we get to that point as we're starting to rocker over that. If that axis of the rocker is in front of or behind that first MTP, then that's going to change the mechanics of the foot, and it could conceptually, and we talked about this a little bit in our callus presentation, push the foot either forward or backwards, creating friction or creating an issue or pain with what's going on.
I think it's interesting too. There's two different sides to how people like to sometimes handle medically hallux rigidus and limitus. You know, I've been around physicians and therapists and chiropractors for that matter that will offer a carbon fiber foot plate to really limit and stop motion through the big toe and through the hallux if it's not there. So they try to protect it in that way, much like you would tape it. But I'd much rather use this approach because, again, you don't want to stop that hallux for you. You don't want to, like it was said multiple times, if you don't use it, you lose it, right? So if you're preventing motion from that big toe completely, is that being counterproductive in that it's going to be harder to regain it sometime present, some future time. Whereas if you have a rockered shoe, I think you kind of still can get a little bit of mobility through that, depending on how aggressive that rocker is, but at the same time, allow the rocker to do a lot of the work that the toe wouldn't necessarily have to be forced to do. Do you have a thought on that, Ivo?
Nope. Same thoughts.
Okay, perfect.
So the toes aren't lifted inside the shoe, but that we can rocker over with that nice wide toe box.
So I think Dr. Perez and the Gait Happens group does a great job with their video there, talking about some of the key factors to consider when looking at either a regular traditional stability type shoe or versus a more minimalistic natural type of shoe. We just wanted to add a little bit of our thoughts and really supplement some of the things that we like to also consider.
Absolutely. Way to go, guys. We love your videos. Look forward to working with you some more.